Hi, this is Ashley, and I'm going to give a rebuttal for Christy's debate topic on punitive actions for healthcare providers, accountability, and responsibility for medication errors. Punishment demotivates healthcare staff. Overall, that's just what it's going to do. A healthcare affair report published in 2020 showed that institutions that do not support punitive damages and measures have 80% of motivated staff, high patient satisfaction levels, and relatively better overall healthcare outcomes. That's 80% of staff. Just imagine if you would take 80% of staff and encourage them to self report only because they would know that they would not have punitive damages. Instead of reducing medical errors committed, punitive techniques exacerbate the problem by focusing on the symptoms rather than the errors. The focus should be on the bigger picture. The total well-being of different people should be used to determine the trade-offs that are worth consideration. That is to say, if medical professionals have given their best to save lives and enhance population health, punitive actions in the event of medication errors occur undoes the motivation to continue doing good. People tend to make mistakes when a gun is held over their head. Accountability puts medical professionals in check to ensure patient safety, standard of care, and care quality. However, the principle of aggregationism dictates that the crucial element of accountability should be balanced with fairness and support. Punitive actions drift away from the tenets of this principle because the broader context of errors is ignored. Healthcare providers have replaced punitive damages with training their medical professionals report better and quality patient outcomes. Training accounts for 70% of the factors that help medical professionals deliver quality care to patients. It is important to recognize that instead of subjecting medical professionals to punitive actions, staff training can achieve the goal of keeping medical professionals in check. Proper training can help reduce medical errors from being the third cause of death in the United States. Staff training ensures proper patient data management, documentation, and interpretation. Training offers medical professionals the extra experience to prevent future errors. Institutions that integrate systems into the treatment help increase patient safety and decrease the likelihood of medication errors as systems enhance communication among all. The use of modern systems such as electronic health records can potentially reduce medical errors up to 80%. Therefore, integration of the electronic health record framework into medical practices is best suited as a means of reducing medical errors instead of punitive actions. Counseling also enhances medical professionals' skills, knowledge, and awareness concerning best practices and safety protocols. Suffice to say, imposition of penalties makes medical professionals prone to stress and depression, conditions that may cause them to make medical errors unconsciously. Medical professionals have revealed burnout because of long working hours. Excessive workload increases the chances of developing depression among medical professionals. Rather than punishing them, institutions should come up with counseling programs where open discussions about their experiences are discussed and preventative measures adopted. Counseling will help ease workplace stress, thus being able to work productively and give quality health care to patients. So, Christy, yes, I would be greatly affected if that medical error happened to me or my family. But we are all human, and mistakes are going to happen because we are human. But do we want constant punitive damages in the back of our mind while we're trying to take care of the sick every day of our lives? No, we don't want that. We want to be proactive instead of reactive.